Bonjour à tous, bonjour à toutes.
Good morning.
We are going to talk about education, access to housing, and the persistence of vulnerability pockets. We have with me two representatives of the research community. And first of all, I have Mr. Paul Blanchard-Arquet, who is a psychologist and architect and a teacher, and Dr. Aimé Assoin, who is a researcher professor at Alassane Ouattara University. And I have two representatives of the local authorities with experience from Cote d'Ivoire and Senegal. So I have with me Mr. Samba Bamba from the Bagwe district, and Mr. Ndiaye, who is the Kailak of Senegal. And glad to meet you. And I hope that we are going to have, let's say, fruitful engagement with Cote d'Ivoire and Senegal. So today we are going to talk about housing, education, which are topics referring to fundamental rights for our citizens, since we are talking about major topics for the improvement of living condition of our citizens. And we spoke about also the societal function of the city, and today what we are going to discuss is the role of local powers and to guarantee these fundamental rights, and think about also the initiatives that can be developed by local and entities and to meet the needs of the population. I'm going to ask Mr. Sema Bamba to introduce to us what are the skills available to address these issues and give us an overview of the current state of affairs. And thank you very much. And I'm privileged to talk about access to water supply and health education in rural areas and persisting, let's say, vulnerability pockets. So I will speak in introduction that the regional council make, and also the current state of affairs, and then we are going to conclude. So the Bagwe district is one of 31st and district of Cote d'Ivoire. And in 2013, when we let's say wanted to, let's say, run for election, we initiated a meeting with the local population to make the situational analysis. And at the end of this exercise, village per village, everyone used to come with the actual situation of the facilities and expressing the needs by priority. And the findings were quite interesting. We identify water supply, school building, and health facilities. So as part of our communication, we use the following approach to address the issues. We made efforts in the region, and the deliverables and emergencies to be addressed to address pockets of vulnerability. The approach used by the board was quite simple. We know that the villages have, let's say, insurance and entity with the needs. The findings were submitted to the traditional ruler for confirmation. We know that there is mismatch between this mutual entity, and we approach them and opinion leaders for confirmation of the expression of needs. And of course, we compiled such data and then we came up with a departmental and a district and database, including sub-prefectures and villages. This approach, which forms part of inclusiveness, is in line with participatory democracy, and the deliverables are relevant because it proceeds from local population. What were the efforts made? The regional council, as part of his quarterly program, sought to bridge the gap of facilities. This district went through crises for 10 years as a result of rebellious acts, and also in the area of education, water supply, and also roadways. Thanks to the effort of the regional council, this shortcoming has been reduced in the area of education and health from 2022 to 2024, because we are talking about what is yet to be done. The investment forecast is as follows. In the educational sector, 15 projects to the tune of over 1 billion and 7 million. The health sector, 1,042,298. That is 22% of the budget. The infrastructural sector, 492 million. That is 10.75%. These three sectors altogether absorb 70% of the overall budget. Regardless this tangible result and education, water supply wise, there are still some pockets of vulnerability. What is the current state of affairs? So we recognize that many investments were made for education and health. The same does not apply for the water supply sector. We need to bridge the gap. We will need 184 boreholes and 21 HVA improved motor pumps, and 22 H2. In terms of financial estimates, this require about 11 billion 460 million CFA. It is important to note that the reduction of vulnerability pocket will make sense if some concerns are taken into account. Inclusiveness of the youth and women in rural areas and also in urban settings, and the asphalting of roads, improvement of access to electrical power, and cross-border security. And this is neighboring town with Mali, with let's say 200 kilometers of borders. When you look at the map of Cote d'Ivoire, it is let's say embedded into Mali, and we are, let's say, surrounded by some mileage. Following an investigation, 1/3 of the population is unknown to the vital statistics department, and we are getting ready to address that. We set up in this respect a dedicated committee that we start working on the 30th day of October this year, and we have to do that because it is our duty, and we are getting ready to digitalize the vital statistics department. And in concluding, we can say that this is quite key to the development of population. a lot has been done by the Bagwe region, but in the light of the pockets of vulnerability, and there are some weaknesses, additional effort are required. However, development will be total if all the aforementioned dimensions are considered. There is still a gleam of hope. Thank you for your undivided attention.
Merci, Monsieur Bamba, pour cette présentation.
Thank you, Mr. Bamba, for this detailed presentation of your effort. And thank you for having made a situational analysis of villages. We are talking about participatory democracy, and we have to talk about access to education, and based on the civil society and local authorities, and how to get them involved. Thank you for having highlighted this in your presentation. Now I would like to give the floor to Dr. Paul Blanchard Ake, and you have a microphone right here. Okay, thank you for sharing your vision on current stakeholders in respect of these three topics. Well, as regards this topic, the issue of access to housing in urban areas and the persistence of vulnerability pockets, you have to say that the housing sector, health, are, let's say, intertwined, and we cannot look at them separately. So, as far as housing is concerned, I know that some expect the economic dimension in terms of banking loans and what have you. Truly, the problem is not to see it from an economic standpoint. Everyone knows what economics is all about, but I will use another paradigm. So, in my opinion, the government has made a lot of effort when it comes for social housing. At the Ministry of Construction, they set up CAPI. They are responsible for brainstorming about housing. And in terms of health, there was the presidential program of genders, so that all hospitals may have required resources. And there was also this assurance of health. Many efforts are being made, even in terms of education. You have the program and education for all. Why do we still have pockets of resistance? I would say that there is a matter of ideology and segregation in the minds of the local population, and to move out and to stay in Cocody or in Rivera, in their opinion, this is the expression, is the above of the aboveables. So to go to Cocody, which means changing a society, social class. So development in Africa is tantamount to mindset. But if in our mind we are not released from socio-African issues, we cannot make headways. That is why I would like to move in this direction. So there is this, let's say, I want to remain in my home down in Makori, Treshville, and there is, let's say, an affectionate bond. Even if the government is building houses in Songon, people will not feel, let's say, committed to go and dwell there. They want to stay in Treshville because there is I was taught there, and I got the same education. So that's the problem. You also have the issue of security. Security, people want to be in Imputo, in Blocos. Why? Because they say that security is there. If you still in Anono or in Blocos, you know what will happen to you. So these are societal issues to be explored. As academics, we do research and we go to the local population to identify the reasons behind resistance. And there is also closeness of communities. It is easier for people to go to Bejerville rather to go to Bejerville, to Songo. Between Bejerville and Cocody, there is no border. If you go to, you don't feel that you are crossing. It's like a buffer zone. However, to go to Zongo, you know that you are traveling. So that's the problem which prevent people from going there. Even some efforts are made. That's the mindset behind this. And you have also the also urban setting, and we have a tendency to build, let's say, villas or low rise houses, but you have to can build something which is vertical. But we are, let's say, moving to a local. I don't know, are we going, maybe we are going to build on the lagoon. So these are the few issues. Some studies were made on sociology and what have you. There is a phenomenon that of furnished flat, and the Ivorian law seems to be silent on furnished flats, and they are, let's say, um, competing with large hotels. If someone wants to inhabit the house and have a furnished house, which will give me 15,000 per day, if someone has to, you know how much it is per month. So where you have housing, people have turned these houses into furnished apartment because they say it yields more money. Though that's the problem with regard to housing. And in terms of health, people like using an let's say, traditional medication, and based on, let's say, therapy based experience, and they have some feedback, and also the distance. Some hospitals are in place. If I have to wake up at 5 a.m., travel to Trashville, whereas I stay in Abobo or elsewhere, once I've done that, I will not do that the second time. I will call someone in the village for him to provide a traditional medication. This is another challenge, and also belief is involved that some diseases are African diseases and has to do, let's say, treated the African way. When someone his arm is broken, he want to be treated traditionally rather than going to a hospital. And there are some disease that they call enfant, or let's say a bird-like child, and the European medicine cannot address it, and we have to use traditional medicine. Even though access to is have been made, the mindset is bringing us back to our tradition. Let me wrap up with education. This is also a matter of ideology, and some, let's say, professions or occupation cannot be accessed, so we don't dare to, let's say, embrace these studies. And in the popular mindset, let's say, to study economy will provide more money. People don't want to become technical people or technical officers, or work or the in the hotel. You said you want to be a chief cook. I don't want my son to be a chief cook. I want him to be a manager. So you have access to some, let's say, fields of education that people do not opt for. We can, let's say, draw inspiration from the American system, and people come to recruit, and they are giving, so let's say, scholarships and for students to join the university. In this is a northern American model that we can draw inspiration from. With the influence of community, you have different economic and communities. We want children to get minimum, if he reach class 6 and he can read and compute, that one will become a trader. So if he does some maths, he will be able to handle the business of his relatives or parents. So these children can be, let's say, restricted education wise. So these are the number of challenges I've identified. I hope that I was able to cover it all.
Thank you. This was a clear picture of how the area of Abidjan can be perceived. I've learned a lot from that contribution. I have a lot of questions, and certainly from the room we have more questions. You said interesting things. First thing, urban renovation in popular areas. We saw in the word that what they did was to try to keep the inhabitants of those areas. We saw similar situations in Latin America where they had an integrated renovation of those areas by improving the access to housing, but also access to education and employment, so that these operations are, first of all, profitable to the inhabitants of those places. The second thing has to do with the right to to benefit from various rights, because if citizens are supposed to be equal, then they should be eligible to similar rights, whatever their location. Thank you for your presentation. Now Mr. Baban Diaye from Senegal is going to share something maybe different. Thank you, Madam. I also want to say thank you for having me at this panel. I want to also say thank you to Mr. Bamba and to the two experts of housing, thanks to whom we can share our perceptions of these topics. I will address these three questions. So access to housing, healthcare facilities, and vulnerability pockets. I'm saying it in my capacity as working at the Ministry of Urban Development. The second aspect has to do with education and health. I've done a lot on this topic in my usual activities in Senegal. Now, regarding housing, we may have different situations from country to country, but in my country, we have a rural exodus where 70% of the populations used to be in a rural area, but what happens during the dry season is that the population will migrate in urban areas. And when they come, they will just live or settle in places that are not suitable for housing. And that is where we have most of the flooding happening during the rainy season. And when these disasters occur, the government has to take the necessary action to assist these populations. And this requires three solutions. The first one is the most expensive. That is, when people have occupied land without respecting the rules, then we need to have a restructuring operation, and this is expensive for the government because we need to find a resettlement area for those people who are going to be resettled. Not only do we have to resettle them, but also should they be given the necessary public service that goes with the operation. We also have to take necessary measures to avoid those populations to come back to those areas. Now, the growth of the population makes it more complicated because the land management requires to take it into account in order to create the conditions whereby the housing situation will be improved. Now, in order to prevent the occurrence of the illegal occupation of areas, the land development is the solution, because the urban development plan should include housing and measures to control the occupation of areas so that those who come will be settled in suitable lands. And the most important aspect connected to health matters is to have a democratic mechanism, because when we say health, we are talking about different health services that have to be provided to the populations depending on their financial capacities. So each group of population has to be provided with the health services that they can afford. Depending on the different types of services that they need. So it is an obligation for the state to provide the populations with a whole chain of healthcare supply. And in the management of those healthcare facilities, the communities will be involved. The community will appoint a sort of board that will be in charge of managing these facilities in the way they will be run, they will be operated. So the management will be monitored by the communities, and this is a strategy that we are currently implementing. Another aspect is to implement innovative solutions. Like, for example, in the case of malaria control, we have developed innovative initiatives thanks to the support of Afrique France project, whereby we have acquired mosquito sensors, and doing this we have reduced in a significant way the malaria pandemic. Another aspect is to develop a solidarity mechanism. In each city, not everyone has insurance. We have populations working in the informal sector who also need to be assisted. So the measures implemented at national level, decentralized at local level, might not be enough to enable though some portions of the population don't have access to those services, and if people do not have the means to afford their prescriptions and consultations, they will go to traditional medicine, whose impact we know well. That is the reason why many of the initiatives that we have taken. You know, we have 30% of our populations who are seen as vulnerable, and for them, we have health solidarity initiatives that are conducted in collaboration with NGOs and medical doctors. So we take like 1 week dedicated to free consultation for vulnerable populations on a specific disease. So such operations are conducted for those groups of populations. We did all this with in collaboration with NGOs. We've conducted free consultation or free screening campaigns of specific diseases for vulnerable populations. Every year in January, we conduct free surgery to vulnerable populations who cannot afford surgery. This is what we call solidarity initiatives, community solidarity initiatives for the poor populations who, whatever the situation, will never go to hospital because they don't have the means, they cannot afford the medical service. Now, regarding education, the example that we have here, we have many schools, schools without any fence. Sometimes schools will be made of shelters, and sometimes the people have to move from one village to another village far away to attend school, and sometimes it is difficult for girls to go to those schools. So at a certain point we have started what we call proximity schools, and these schools sometimes are useful, and in partnership with ABM and with the contribution of the Chamber of Works, we have established a mechanism whereby we can buy some materials and equipment to build schools. I mean, material that are not expensive, material with which we can build those schools very easily. We also build the fence to schools where there's no fence. It is very important for us that we are able to do that. So these young people are recruited. Young people are recruited to make these contributions to compensate the lack of school facilities. We have also other initiatives. We have created virtual libraries. You know, those physical libraries are disappearing from our cities. So what we do is to create those virtual libraries where uh, everyone can have an easy access to those books and documents. There's also the civil registration service. You know, it is a service delivered by the district, but sometimes a schoolboy needs to sit for an exam and he doesn't have any birth certificate. When you go, when they go to the civil registration office to be delivered a new birth certificate, you know, sometimes they don't have any copy which is requested. Sometimes children have to go to secondary school, to start school, but they don't have any birth certificate or any document that is requested for their registration. This makes the situation difficult. So now what we did is to digitalize or dematerialize the process of delivery of those administrative documents, so that children can have their official document and facilitate their access to school. And another measure taken was to facilitate the registration of children in schools that are close to their living area. Because if there was no support by the government, it would have been very difficult. This is, in a nutshell, our achievement in the various fields: housing, health, education, which has been an innovative solution for us. Thank you, Mr. Ndiaye. You have presented initiatives that are full and cross-cutting and which reveal the capacity of the regional government in collaboration with the central government. I think there was somebody wanted to say something over here. Thank you. Good morning. I am Charles Cyril. I'm the General Commissioner. I have an important information to share with the participant who came from sister countries. Some of your passports have been taken from you at the airport. This is the normal procedure. You have received a receipt. You know, the payment of PCR or COVID test is to be supported by the organizing committees. I'm going to circulate a list around the room. So if your passport has been taken by the immigration service at the airport, let us know it. You fill the form that will be given to you. You also fill the form for the COVID-19 testing. Thank you, madam. Well, coming back to our panel, Mr. Ndiaye was explaining their experience. He spoke about the public policies. I think we can also highlight the information given regarding democratizing the public services, facilitating the access to these services for the communities. That is what you explained through the various public policies that were implemented. And the question today is to know if there are public policies. Yes, a lot of effort are being deployed by the government. Now, how do we improve those initiatives? Maybe through the involvement of the citizens in order to have better result for the poor population. So the last panelist before we move to Q&A. So Dr. Emi Aso, you have the floor. Thank you, Madam Moderator. I also want to say thank you to the participants. In Côte d'Ivoire, usually we say that we have a lot of researchers who do not find, and we find a lot of researchers, we don't find a lot of researchers who find. So I just want to reassure you that we are part of those who find, and I'm going to share some of our findings with you. We are university professors. We are not in politics, so I will say things plainly. You know, when we say research, we have financial and social indicators. Now, regarding the financial indicators, in Côte d'Ivoire, you are considered as young if you do not have 735 per day, and you are extremely poor if you are not able to have 500. And to these economic indicators, we have social indicators: access to education, access to health, access to a decent housing, access to 2 meals per day, and also access to entertainment. But this morning, I will focus on access to decent housing. Housing is decent is important, because you can have access to housing that is not decent. You can have access to health care service that is not efficient, or to education which is not suitable. So I will focus on those 3 elements: access to education. If we consider the existing literature on education, the Ivorian government dedicates about 80% to its 40% of its budget to education. But what I have to say is that these 40% are mostly used for salary and operation. But today we are talking about free education. Parents are here. Is it actually free? Is it really free? Somebody is answering, but let me elaborate. We are speaking about free education, but is it what is being done actually? I know that a lot of effort has been made by the government. Books are distributed free of charge. NGOs, organizations are participating in the process. But one of the most serious issues is what the government is trying to solve this year. We set the cost of registration to 6,000, but then we have additional costs that come. But this year, I think the government has decided to solve this issue. And when we speak about access to education, we should understand that the Ivorian system, or either health system or education or housing system, the system is an elitist system. It is, if we take the education system, in education, you know, for those who are older, you heard about that exam which was implemented before the A-levels to eliminate a lot of children who became farmers today, because that the purpose of that exam was to make a selection. And beside this, we had the exam of completion of primary education, where we had different series, first series, second series, where different ages were considered. Here in that system, if we wanted those of the special group to have a specific score to pass the exam, then it is because they are considered as better than the others. So the system is too selective that it has collapsed at a certain point. Sometimes some adaptation was attempted in the education system. Sometimes we change strategy in order to adapt to reality, but sometimes the result is not enough, and we need to have a better approach. Today, in the high education, in a university, from primary school to university, we are still trying to find a way to give better access to quality education, but there are still challenges to take. There's what we call the mass approach, the massive approach, or the orientation system causes difficulties. A student who passes the A level at 6 or 17 years and he's sent to a certain sector, a branch, you know, this is part of what makes it difficult to have access to education. It is a right. Some people will say, well, we took into account the capacities of the children, but there are many things to review. Now, in the education system, access to education for everyone. Today, we cannot ignore the cost. The child is sent in a private school, maybe a private university, but the cost of registration is an exclusion factor for that child. He cannot pay, he cannot afford that, and you know, what they do is to try to come back to public system, because they see that the cost of private universities is not is too high. If we still talking about the education system, I said massive approach, which is, you know, we have a target of at least 5,000 new university professors that have to be recruited. Normally, this is the extent of the gap. 5,000 professors needed, but the government cannot afford it. So we shifted to another system. You know, we have with the outbreak of the COVID pandemic, we have experienced what we were hardly implementing. That is the online teaching. A professor standing in Boaké, delivering a lecture to students everywhere. But here, the challenge is that some students do not have their computer or laptop. But at Université Alassane Ouattara, we have created a platform where the lectures of the professors are posted, and anytime the students find the means to do it, they will go and upload the video. Now, on health, my colleague spoke about it, as well as my senior. Now, regarding health, the system, since the conference of Bamako in 1987, the system has almost been privatized. But after the post-electoral crisis, there was what we call the free medical service, where you were supposed to go to hospital without spending any money, but it was too huge a cost for the government to support. Then we shifted to specific free services, selected free services. But the challenge in this process was the lack of medicines. Now, the question is, how comes our healthcare facilities are not used by the populations? Based on the surveys that we have conducted, we've understood, first of all, that the cost was a factor. So the financial accessibility made some of the populations to not to go to those healthcare centers. The second element is the way people are received. You know, sick people going to hospital, if they are not received in an appropriate way, will not go back there anymore. we also found out that some people were living in the surrounding or very close to the hospital, but they preferred to go very far away because for them in the hospital they were not well received. Another sociological parameter was tackled. There was a survey in the north in an hospital that people didn't like to go to, because in that hospital was built on an old cemetery. So anytime a sick person went there, in mind they had the picture of the cemetery that was existing on the site where the hospital has been built. So that was psychological. Today, when we take the urban system in Cote d'Ivoire, it is also based on a sort of segregation. When we look at the areas, we have residential areas like Cocody. You want to live there, but you don't have the means. You cannot afford it. So the system excludes the poorest. In 2015, an operation of 200,000 houses were supposed to be constructed, but until now nothing has been done because it was too expensive. So thank you. Maybe with the questions I will elaborate some aspect I've not covered. We have a bit less than 10 minutes, so I will give the floor to the participant for the questions or contributions. Microphone over there, please. Please be short so that more participants can speak. I'm Mrs. Kiprin Cecile, Director of Social and Health Services in Port-au-Bouet. I want to share the experience of Port-au-Bouet with the audience. Now, in the health sector, we have three mechanisms to facilitate access to health services for our population. In Port-au-Bouet, we have 8 healthcare centers. 3 are urban and 5 are in villages, so rural centers. For those health centers, every year subsidies are allocated in order to organize activities, public activities. During that period, all the activities are free of charge: consultation, medicine, analysis, etc. But this year we wanted to innovate with specified consultation and screening. I heard the mayor of the Senegalese mayor who spoke about it. So this year we did the same thing. We've consulted 1,400 persons. We have 400 persons of 40, more than 50 persons have undergone surgery in November. From 16 to 21st November, we are also going to take 300 persons for surgery. It is a social operation that has impacted our populations. The second option is a subsidy dedicated to social affairs, but health is a major part of that subsidy. In 2020, 40 millions were used for health only. Generally speaking, the populations will. Yesterday, I was speaking with the mayor of Cocody. The populations come to the decentralized administration to be assisted financially. So we have a social service that is dedicated to this. The right to the mayor and the social service. In the past, we used to give money to those people to go to hospital, but for 2 years we have changed the approach, and what we do now is to conduct investigation with our social workers, and we try to identify the need for assistance, and the social workers will be in charge of assisting those sick populations. The social worker will go and pay for the service, and the person will receive the service. If it is about receiving medicine, the same thing would be done. So like this, we know exactly who is in real need, because we have so many persons coming without being in a situation of necessity. So with this approach, we have targeted the most relevant part of the population who needs this assistance. Good morning. I am Mr. Kuya, Secretary General of the Teachers Union in Cote d'Ivoire. And this panel is relevant to me because of that. We all know that housing is a real problem in Cote d'Ivoire. When we consider the Maslow pyramid, housing is a priority. So I came in this panel to find solutions and partners that would assist the teachers in the private sector in Cote d'Ivoire. You know, we as teachers in the private sector, in private schools, things are very difficult for us, you know, because we are not paid normal salaries. And as a leader of the union, I'm struggling to find solutions with partners who can assist us in in the housing. Thank you. We have one question over there and one here. Good morning. My name is Kochi Eric, director in at the Bank of Habitat in Cote d'Ivoire, and we have solutions. You know, housing is not a new challenge. It was existing before the outbreak of COVID-19. The only thing with COVID-19 is that it has emphasized the issue. You know, when the new government came, you know, social housing was promoted, but it is a program initiated by the government, but actually a private program. But once the private sector gets somewhere, profit will become the priority, and the social impact that was the objective will be lost. That is one of the reasons why so many difficulties are experienced. You know, today we have so many houses that have been built but are not accessible because their facilitations are not existing. So, you know, the topic of this session is housing, health, and education. But somebody who is not well accommodated cannot have good health service and education. So everything starts with housing. It is important to solve the problem of housing. There's one thing in the 60s which enabled Ivorians to have access to decent housing. That was the operation in which houses will be built by the state and occupied by the populations, but then the house would be, after several years, the property of the inhabitant. The other thing I want to say is that Bank d'Habitat, which is a state-owned bank, is an instrument that the state is working with to promote social development. So maybe later I may discuss with our friend, and also to tell you that we are all along the chain because we assist the house building operations. We cover the whole chain. We also assist the populations in having necessary loans to buy their houses. This is your bank. It is the Bank of Ivorians, and we have already conducted projects for specific social and professional groups. Last contribution here. And then we will have to close to conclude the panel. Thank you, Madam Moderator. I'm Sanogo Mamadou from Cocody. Mine has to do with housing. In Cote d'Ivoire, what we notice is that housing comes before planning, whereas it should normally be the other way. Today you see many areas, a lot of constructions without any land development. But you know, land development is very expensive. That is why people prefer to go and buy rural land, where people pretend that it is partly developed, but there is no such a thing as partly developed land. Either the land is well developed or not. So when I say land development, I mean everything is taken into account. Drainage system, road, network, and everything. You know, in 2012, developed land would cost 17,000 per square meter. So how much would the operator sell it to make his profit? And you know, this shows that in terms of housing, we cannot have social. It doesn't exist. There's always a segregation that will be made. So when we say social housing, it is not right, because I remember that in 2010 the government said that people would have access to houses of 5 million. So when I heard that, I screamed, because how are you going to do that? He who tells you that he will give you a land, a house of 5 million, doesn't have any land. The state is supposed to buy the land from the owners, and this has a cost. You know, if the state should buy a land 2,000 square meter, they are not going to give it to you 1,000. At least you will have to pay the 2,000 back. This is the main problem of housing in Cote d'Ivoire. Please, one last question, because we have to keep the to keep in the time. I want to say that there is social housing. Can you introduce yourself? I'm Jima Karamoko, architect. just to say that there is a possibility to make social housing. In the 70s, the government had initiated operations in some areas of Abidjan, Yopougon, Marcory, Cocody. These operations were operations where the inhabitants could become owners of their houses, and social housing is possible if the state is strongly involved. With the private operators, it's not possible, but with the state, yes. And to do this, we need to go to tackle the root of the problem. That is the way the houses are built. And here, the construction of houses is most of the time in the hand of the informal sectors. You know, the landowners are in the rural area, and they are not always they don't always take into account the various parameters for the construction of houses. And this is the most important or the weakest point in the promotion of urban development. Thank you for your contribution. Now I give the floor to the panelists. I see one lady in the bottom of in the back of the room. Good morning. I am Mrs. Jakite. Social housing is very difficult, and it requires more involvement of the state. Now,
Allez-y. Donc,
there are mechanisms that actuaries can implement, and that will help you as a group to have access to your to houses.
dans ce sens-là, donc allez-y, vous voulez nous partager quelques mots de conclusion par rapport.
D'accord, ben, je pense que nos conclusions, c'est que ce que j'ai remarqué.
What I noticed is that we've had very relevant contributions by my co-panelists. So I think in life you need to have to be ambitious. And you know, there are situations that we're experiencing in our living areas. You know, sometimes, you know, people want to improve their living conditions, so it's normal that people feel like moving from one area to another area in search of better housing conditions. Some areas will be more accessible than others. If you are living in Cocody and you want to go to Plateau, sometimes commuting can be difficult. Now you see, in rural areas, a woman will hardly accept to be consulted by the nurse working in their village. If the nurse is a man, she would prefer to be assisted in her delivery, for example, by a woman. So if she doesn't have a woman to assist her, she will just go back to the traditional ways. Now, coming to the civil registration, I think our communities need to be sensitized on the necessity to be officially registered. Now, somebody spoke about the bad conditions in which people were received in hospitals. This has to do with the lack of education or the So I also want to say that we work in collaboration with the government. Sometimes we are confronted with some difficulties when we have to deal with decentralized public entities. And sometimes people will resort to, they will refer to the wrong administration. So thank you to everyone and welcome again to my friend. He didn't tell me that he was coming to Côte d'Ivoire. Thank you.
Okay, thank you. Yes, I was in Lyon with the president at the meeting that will be held on the 11th. Thank you. First of all, I would like to contest what he said, and we talking about this straightforward language. Not that we are not political persons. We are academicians, and we are academics. So, and I've also studied in Paris. In Côte d'Ivoire, I know many of your heads of local councils are senior executives. We want to come up with sustainable solutions for our local population. So when some people say, why do you do politics? If you are not involved in politics, who is going to take care of the local population? And you talk about a number of people who are operated. I think this is very important. If we are not made this, and that will be without life we cannot do anything. So you do not become let's say stakeholders. The questions of have been asked. It takes some effort. When we talk about this act in Senegal, the government is intervening, and there is negotiations. We negotiate with the persons, and you have to argue with the various stakeholders, with the owners. At times, out of 40%, and it's up to the government to use the other percentage of developed plots of grounds. You know that there are some stakeholders that are against that go against you. So you need to discuss with them and to tell them about the forest and develop it and make it available. In the program of 100 houses, the government committed to commit to the private sector the management of this, and to also sustainability, and the document will be provided by the government, and they will take into account the government is responsible for everything pertaining to school, and what is when it comes to building 100,000 housing units. So it is no longer difficult to have decent housing units. So one of the people leave the rural areas to the urban areas, and after they come with their family and children. So there is a problem of rural exodus. So, and then there are some ghettos or slums, and therefore you see that the population is more expensive. So that's the reality. And due to the level of poverty, and we don't have social security, so we need also to build solidarity, and this is what we do for the various operations, and we enter into partnership in the implementation of this effort. Without this solidarity effort, a portion of the population may not be accessing health and also social services. We also have, let's say, homeless persons, and we still have some houses like huts. We have some, let's say, junior high schools, and also we need to put together the communities to enable children to have access to school. So these are the real difficulties we are being faced. But with the inclusive, and we have to have some solution to enable us to have access to housing and to health, and also to education, and also to address challenges that will appear, let's say, in many years to go, and in areas which are not, let's say, habitable. So thank you very much. Thank you, Mr. Njai. Dr. Aswe. Well, I don't want to keep long, but what I would like to say is that social housing, and which is also decent, is possible. Access to education for all, and it's also possible to come up with education, or quality education, and also health and sanitation for all. It takes the involvement of the government, but all stakeholders, and we'll be able to make it happen. Now I would like to speak on that, to say that it is possible. You gave the example of Latin America countries that could make it. We need to come closer by also including a shift of mindset. And one last thing, we have the universities on board. The government can also provide the budget lines for research, and these can form the subject of master's degrees or doctorate, and we have incubating research centers, and solution will come from there. So this is the end of this panel. Thank you, and Segelu and the network of let's say territorials, and I'm open to discussion if you want to share your initiative at the local level, and for the protection of human rights locally. Thank you for your undivided attention and participation.